Medical imaging has been one of the most important breakthroughs in modern healthcare, enabling innovations that have significantly transformed the detection and treatment of disease and physical conditions. Celebrations of the 11th International Day of Radiology aim at boosting radiological access and for patients started with a march past from Arch 22 to the Edward Francis Small Teaching Hospital, where discussions were held on this year's theme, which seeks to expand radiologist and radiographer support for patients. Postgraduate trainer, radiology consultant at the Edward Francis Small Teaching Hospital, gave a brief history of radiology, highlighting the significance of radioscopy as the eye of machine.
This is a very important day because this is the day that William Conrad Röntgen discovered the existence of X-rays in 1895, over 100 years ago. And so that singular discovery of X-rays gave birth to the field of radiology. So that's why it's celebrated today all over the world.
She further outlined the various fields of radiology and experts supporting the process, including medical doctors, physicians, and biomedical engineers, whose work in radiological imaging is helping to save lives and end disease.
Radiodiagnosis. We use medical imaging to assist the physician to identify pathology in the patient. That's what we do with diagnosis. And radiotherapy uses the same radiation methods to treat patients, and this is especially important for cancers. Medical imaging is one of the most exciting and progressive disciplines in healthcare in terms of technology.
The chief medical director, who is also a radiologist, said the profession is among the most important departments in the health sector, which has prompted authorities to improve expertise for personnel in the field.
All the departments depend on radiology. They cannot put diagnosis. They cannot do any treatment without radiology report for any issues, for the brain, for the abdominal. And all the equipment usually is very expensive for radiology. It's not easy to have all of them in the same time. But I promise you from here that inshallah, we are going to work with the chairman of the board, all the members of the board, the Ministry of Health to have all the equipment.
Fatoumata Diba, a representative from the Ministry of Health, underscored the ministry's commitment to providing the necessary equipment and capacity development for personnel to support effective services delivery.
The ministry is also ready to make sure that the equipment that are needed for the radiologists and radiographers to do their work, the ministry is willing to provide them, and they are working very hard towards this. I want to share with the team that the Ministry of Health has gone very far to make sure that 128 slide CT scan is available for the Edward Francis Small Teaching Hospital.
This is the second time the Gambia is joining the rest of the globe in celebrating International Day of Radiology. Well, officials at the Edward Francis Small Teaching Hospital said training is in a good start, with one specialist in Ghana who will be returning in the country to complete the fellowship training in radiology. While 4 resident doctors are also commencing training in radiology, and this one from Ghana will be the first radiologist consultant in the Gambia. Reporting for GRTS News, I am Dado On Radiology.